Hi friends, welcome to classes by Lab Doctor. In today's class, let us study about this prothrombin test. Okay, so prothrombin test, PT or prothrombin time, INR, International Normalized Ratio. All these are different names which are associated with this test. So, what is this test? PT. This is the most commonly ordered test. You will see that before any surgery or if the doctor feels there is any bleeding disorders, etc. Doctor usually orders this test. One of the routinely done tests in the laboratory. So this test, prothrombin test, is a very commonly done test and it's a very useful test because this test will tell you how much time it takes for your blood to clot. The bleeding has to stop. For that, the blood has to clot. So PT will tell you how much time your blood takes to clot. But what happens is the value of this PT varies from different labs. So to normalize this, to standardize this, there is one ratio called as INR. We will study about all this in detail, but just to give you a brief overview. So this PT INR will help the doctor to make a decision on what kind of a treatment the patient has to be put on, how to monitor the patient, whether to take the patient for surgery. All these decisions are made based on these tests. First, let us study what actually is this protein. Okay, so your PT is nothing but a protein. So this protein is primarily produced by the liver and the liver will secrete it into the bloodstream. So whenever we have to assess the liver function, if you have seen a patient who is having cirrhosis of liver, doctor usually orders PT because in them the PT values are altered. So to see the liver function, to assess the liver function, especially like in cirrhosis, hepatitis, alcoholic liver disease, liver failure, the PT is prolonged. To assess the liver function, to see the clotting factors, how they are functioning, your doctors orders this test. So, whenever the PT is high or INR is raised, this says that this will give us an idea about the severity of liver disease. So whenever we use the scoring system to score how bad the liver disease is, PT is also taken as one of the parameters. And also PT is also used as monitoring whenever the patient is having upper GI bleed, etc., because of this esophageal varices, etc., in case of liver failure, then also PT is used. So because this is produced by the liver, to assess the liver function, PT is one of the major factors. PT is also vitamin K dependent. There are few factors which are dependent upon vitamin K, like factor number 2, 7, 9 and 10. Vitamin K, it is very important vitamin because prothrombin requires vitamin K for proper synthesis and activation in the blood coagulation process. How? This vitamin K will enable the post-translational modification, especially for the gamma carboxylation. For the gamma carboxylation of prothrombin, you require vitamin K. If you see this cycle, this warfarin, the medicine warfarin, will inhibit this vitamin K epoxide reductase. Okay, so once you put this warfarin, vitamin K will not be reduced, and this reduced vitamin K is required for the carboxylation, for the conversion of precursor prothrombin to biological active prothrombin. That is why prothrombin is dependent on vitamin K. So if this is not happening, this will not get converted to its active form, and if it doesn't get converted into active form, it will not help in the clotting, and if it will not help in the clotting, blood will not clot, and if the blood will not clot, there will be bleeding. Hence these factors 2, 7, 9, 10 are dependent on this vitamin K. So I have told you that it is first in an inactive precursor. prothrombin precursor. Okay, and then by the action of this vitamin K, it gets converted into active form, and then it helps in this coagulation cascade. During the blood coagulation, prothrombin will be converted to thrombin in the presence of thromboplastin and calcium ions, and this thrombin will be helping in the formation of fibrinogen to fibrin, and the blood will clot. Okay, so the same thing is explained here, where there is an external injury, and here the prothrombin gets converted into thrombin with the help of this calcium ions, etc., and fibrinogen gets converted to fibrin. So prothrombin is converted to thrombin, prothrombin activator, calcium is also required. Thrombin will help in the conversion of fibrinogen to fibrin. So what is the difference between prothrombin and thrombin? Prothrombin, inactive protein precursor to thrombin. Okay, whereas this thrombin is an active enzyme which will help in the conversion of fibrinogen to fibrin. This prothrombin is present in blood plasma waiting for an activation, whereas thrombin is produced during the blood clotting cascade, and it is an active form. Okay, so this prothrombin requires conversion by other clotting factors, whereas this thrombin does not require activation by other factors for its function. So what is the function of PT then? Why do we need this prothrombin? Because prothrombin's main function is to form a blood clot and stop bleeding. Okay, and this process is very much important for the blood to clot. If there is an injury, we have to form a clot. If there is no clot formation, then there will be bleeding. Okay, so this prothrombin becomes very important. If prothrombin is not there in the blood, what happens? Your blood cannot clot properly. That is why there will be prolonged bleeding, because there is nothing to stop the bleeding. And hence, if suppose there is an injury or if there is surgery, then the patient will have severe bleeding, and that might threaten, endanger his life also. So prothrombin time is a time which we measure to see how much time your blood is taking to clot. Primarily, it will assess the extrinsic pathway as well as your common pathway. So if the prothrombin time is increased, it means that your blood is taking longer time to clot. जब हम बोलते हैं PT इंक्रीज हो गया है, उसका मतलब क्या है? आपका ब्लड ज्यादा टाइम ले रहा है क्लॉट होने को. सो अगर क्लॉट नहीं हो रहा है, मतलब then there are chances that you will continue bleeding. अगर bleeding continue हो जाता है तो it can endanger your life. So prothrombin time tells you how much time the blood will take to form a clot. So if it is taking longer than the usual time, longer than 11 to 14 seconds is normal. Suppose if it is taking more than that, that means your prothrombin time is increased. It could be because of liver disease, vitamin K deficiency, patient might be put on warfarin, etc. Okay, so if your PT INR levels are too high, it suggests that your clotting is not happening normally. So the normal prothrombin time would be around 11 to 14 seconds. But what happens? This varies from one lab to other lab. That is why there is something called as an INR, International Normalized Ratio. For a healthy individual who is not on any blood thinners, the ratio should be between 0.8 to 1.1. Okay, and this time will tell you how much time the blood is taking to clot. Suppose if the patient is put on anticoagulant therapy, we will monitor his INR, and we want the INR should be 2 to 3 times the control value. Okay, so 2 to 3 times the control value is normal when the patient is put on anticoagulants. So when the patient is put on anticoagulants, we monitor the INR to get a standardized value. So if the PT value goes more than 30 seconds, it is very dangerous. It has to be informed to the clinician. It is a critical value. And if the INR goes more than 5, then also it is a critical value. It has to be informed to the doctor, because there is increased risk of bleeding. So remember, prothrombin is a protein. Why you require this protein? Because it will help the blood to clot. If it is not there, your blood won't clot and you will bleed. And if you bleed continuously without clot formation, then your life can be in danger. So prothrombin is a very important protein which is required for your blood to clot. It is produced in the liver because it is protein. It is produced in the liver. Hence in liver diseases etc. we use this prothrombin time to monitor the severity of the liver disease. It is vitamin K dependent. Factor 2, 7, 9, 10 are vitamin K dependent. Vitamin K will be required for the carboxylation. It is required to convert the inactive prothrombin to active prothrombin. So if vitamin K is not there, inactive prothrombin will never be converted to active prothrombin. And hence the bleeding will be continuing. So this is a vitamin K dependent factor. It will evaluate your extrinsic pathway and also your common pathway. So that was in brief about prothrombin. In the next class we will study what are the normal values, when it is increased, what is INR, etc. Thank you so much for watching the video. Please like, share and subscribe the channel. Thank you.